The media roundtable is coming after the engagement of community in Away local government area by the Media Action for Family Planning in Nasarrawa State. The media roundtable organized by Media Action for Family Planning in Nasarrawa State in collaboration with the State Ministry of Health and supported by Development Communication Devcoms and the Challenge Initiative TCI Nigeria is with the theme using community engagement as a strategy to increase demand and utilization of childbirth spacing campaign in the rural communities in Nasarrawa State. Community engagement is a process of working collectively with and through groups of people affiliated by geographic proximity, social interest, or similar situation to address issues affecting the well-being of their people. It is a vehicle for bringing about environmental and behavioral change that will improve the healthcare needs of the community and its people. Underscoring the significance of community engagement strategy, Nasarrawa State Commissioner of Health, Pharmacist Ahmed Baba Yahaya, represented by Director Primary Healthcare, Nasarrawa State Primary Healthcare Development Agency, Dr. Madawa Absalom, noted that Nasarrawa State has put in place necessary strategies to enhance utilization of family planning in rural communities across the states.
We always need media engagement to foster our cause and to get people to know what we are doing, but more importantly, get people to align with those things that will better their health. Without this community engagement, PHC service delivery will be very handicapped. Nasarrawa State looks at community engagement strategy as very key for our work to go beyond where it is right now. The way this strategy is structured, it incorporates the hierarchy of the community leadership, mostly traditional institutions, but there is an element of religious institution also involved. Architecture at the community level, we have, in terms of our own system, we have chiefs agents, community health influencers, promoters, and services agents at the community level. And they also have registers, so they record these things. This woman has sent her to this facility. They can also find out from the facility whether the woman actually went and so forth. So for now,
on the efficacy and availability of family planning services and commodities, Director Social Mobilization, Nasarrawa State Primary Healthcare Development Agency, and the State Family Planning Coordinator, Mrs. Salome Vincent Aya, noted that health workers have been engaged at their various primary healthcare facilities as a strategy to increase demand and utilization of family planning services among young people at the rural communities.
As social mobilization department at the agency level, we are working around the clock to engage our communities, sensitize our communities, engage our traditional institutions from the state, local government and down to the local government level, so that everybody in the state will be aware of these services and also utilize the services for the interest of our community, the state, nation at large.
Contraceptives prevalence rate is at 14.3. So we have a new CIP, that is the costed implementation plan for family planning in the states. The current one is from 2021 to 2024. And by the end of that, we are aiming to have reached 27% of the CPR. For the facilities trained on family planning, for PACs, we have 717 PAC in the state, and so far we have trained 513 primary health care on modern method of family planning, and they are really doing the work. For the remaining PAC that we are not trained, they still provide the family planning method, but they don't give the long-acting method. You can find condoms, you can find pills, you can find injectables in those facilities. And all entities in the state, the Nasarrawa Specialist Hospital and the Federal Medical Center, KP, they are also all trained on family planning, and the 17 general hospitals too are all trained on family planning.
Equally, traditional leaders and World Development Committee leaders during the program shared their experiences in their support to achieving effective utilization and uptake of family planning services at the rural communities. Other speakers also speaks on their role and roles played in terms of community engagement and strategies employed while implementing their mandate in achieving better results for the utilization of childbirth spacing in the rural areas, and encouraged journalists to ask or find out those factors that are preventing people to access family planning services.
So Society for Family Health have been working in the family planning space for a while. Before we enter any community for intervention, what we do is hold a community sensitization meeting with key opinion leaders. So key opinion leaders comprise of traditional leaders, religious leaders, women leaders, youth leaders, and people that matter in the community. So we do this closely with representatives from the LGA department, PAC department of the LGA. So after the community sensitization, what we do next is to recruit people who are going to be working in those communities to raise demand or generate demand for family planning services as well as information. So for us, the strategy we implement in A360, a project that basically reaches out to adolescent girls with emphasis on married adolescent girls because of the northern context. So what we do, we use two strategies. First is the male engagement using male interpersonal communication agents. Then the second strategy we use is the mentorship program. So much as we have husbands, young men who are reaching out to husbands, on the other side we have married women identified from the community with good character who reach out to their peers, married adolescent girls as well within the community.
For TCI, in the states that we support, we also support them with community engagement. However, the strategy we use for community engagement are no different from what the state is doing, because TCI implement through the state whatever structure we find on ground in a state, we work with it, we strengthen it, and then for better result.
I just quickly want to talk about what has been raised here, that there is a lot of knowledge was usage is low. Justice has been done to that, but I would also like to add that for journalists, I think the next phase for us is to move from asking people whether they know, whether they don't know, but also looking at the factors that is preventing people from accessing services. So, as journalists, please let us also shift to finding out why are people not, what are the barriers, what are the factors that act as barriers, why people are not accessing services, and let's present it in a way that it provides leeway for programmers at the state and agency level, as well as partners, to know, okay, how do we target our message to address these factors.
The importance of community engagement is necessary in achieving better results in the acceptability and utilization of family planning services and commodities at the various health facilities for better results in order to address issues of maternal mortality and other challenges in the society. From the Nasarrawa State Primary Healthcare Development Agency along Jos Road here in Lafia, I am Abari Isa reporting for NBS TV News.